We're going to give a minute or so for people to come in, then we're going to get started. So we're going to get started momentarily. Okay, so welcome to On the Park Bench, a public square conversation brought to you by the Congress for the New Urbanism. On the Park Bench presents interactive conversations with thought leaders in new urbanism and allied industries, providing an opportunity for the audience to engage in real time. The webinar series is a platform for CNU members to engage, debate, and collaborate on pressing issues of the day. And today we have zoning that supports physical activity with Jamie Chriqui and Marsha Garcia. Register for the coming webinar, Tuesday, December 13th. Join author William Fulton and CNU co-founder Elizabeth Moule as they discuss place and prosperity, how cities help us to connect and innovate. Fulton's book distills what he has learned as a preeminent writer on urbanism, a planner, former mayor, and academic. Go to cnu.org/resources/ontheparkbench. And join CNU or renew your membership. Go to members.cnu.org/memberships. There's some great advantages to being a CNU member. So I encourage you to do that. Also, go to Public Square, a CNU journal for some of the great content on cnu.org, www.cnu.org/publicsquare. And today we've got a great panel or great discussion coming up. Jamie Chriqui, PhD, is Senior Associate Dean and Professor in the School of Public Health at the University of Illinois at Chicago, and co-director of PAPRN, the Physical Activity Policy Research and Evaluation Network, which is funded by the CDC. Marsha Garcia is Director of Education and Training at CNU. Prior to CNU, Marsha was the University of Rhode Island's Campus Sustainability Officer. I'm Rob Studeville, editor of CNU's Public Square. Dr. Chriqui will discuss longitudinal research that she did for PAPRN that found that new urbanist type zoning codes increased 53% across the US over the previous decade. And these codes are influencing infrastructure that facilitates walking, bicycling, and non-automotive travel across the US. First, there's going to be a presentation, followed by a discussion with Marsha and Jamie Chriqui, and then Q&A from the audience. We really want a lively discussion, so please use the Q&A function of Zoom to ask your questions as they occur to you. And I'm going to pass this along to Dr. Chriqui. You're on mute.
Can you see my screen right now?
Let's see your screen. Oh, there we go.
Okay, super. All right, thank you very much, everyone. Thanks for that lovely introduction. It's a pleasure to be here today. In the interest of time, I'm just going to jump right in. And Rob already sort of like gave you my punchline, but hopefully I have a lot more to share with you besides the punchline that I already shared. And I just want to acknowledge several of my colleagues who have worked with me on this project. And as Rob alluded, some of our funding has come from the Centers for Disease Control and Prevention, as well as the National Institutes of Health. And this presentation today does not necessarily reflect the official position of the federal government, the NCI, the CDC, or my university. So all of you obviously being on this call know what zoning is and about new urbanism and things like that, but you may not have focused as much on sort of understanding the intersection of physical activity with land use, transportation, and zoning. And so I just want to give a little sort of quick background about why does this all matter, and maybe that can help bring some things back to your communities to make this relevant for you. So if you don't know, half of Americans are physically inactive, and it's particularly a problem really sort of in the southern part of the country. About 1 in 2 Americans live with a chronic disease. And we know from research that physically active adults are less likely to have chronic diseases than those who are physically inactive. We also saw during the pandemic that people who were physically active were less likely to get severe COVID. And so physical activity has lots of benefits beyond just exercising and heart rates and things like that. We also know that physical inactivity costs a tremendous amount of money. In fact, people being physically inactive costs about $117 billion in annual healthcare costs. And there was a new study that just came out yesterday on this particular issue, and I'm happy to share that with Rob and Marsha if you'd be interested in learning more about that. To account for this issue and to counter this issue, the CDC launched a nationwide campaign called Active People, Healthy Nation, with a goal for 27 million Americans to become physically active or more physically active by 2027. It wasn't necessarily that all Americans will meet national physical activity guidelines. It's that everybody does a little bit more than they're doing now. So if they're currently physically inactive, but they're doing at least something to get them doing more physical activity than they were before. And as I mentioned, increased physical activity can improve your overall health, quality of life, and reduce healthcare costs. How can communities encourage people to be physically active? And there are lots of different ways, which CDC has identified here on the right. And the two that I'm going to focus on today relate to zoning, land use, and transportation, or providing activity-friendly routes to everyday destinations and access to places for people to be physically active. I was part of a CDC federal task force. It was the Centers for Community Preventive Services Task Force, the Community Guide, where we issued a number of recommendations in 2016 about the combination of land use and transportation interventions, in particular, support being physically active. And so here on the left, we identified a number of transportation-related interventions, as well as a combination of land use and environmental design interventions. And having a combination of the two, in particular, has been shown to be effective at increasing physical activity. At the same time, just last year, the Community Preventive Services Task Force issued a new recommendation related to parks, trails, and greenways, and that having park, trail, and greenway infrastructure improvements, along with community engagement, public awareness campaigns, programming in the community, or ways to increase access to these improvements, in particular, are associated with increased physical activity. And there are a number of things to think about with implementation of both these recommendations, as well as land use and transportation interventions. And particularly the one I want to call out for you is thinking about cross-sectoral partnerships. And as somebody in public health, I welcome this opportunity to speak with all of you and hope that we can serve as a starting point for really improving our dialogue between the public health sector and the planning sectors. So as you all know, zoning is a key policy lever that communities have for really effectuating change in the built environment. It is the primary policy lever. But at the same time, from our perspective, it's a key and probably the primary policy lever or strategy for codifying those Community Preventive Services Task Force recommendations that I noted. And so it can be done through a combination of new urbanist zoning, which you all obviously are familiar with, as well as through traditional Euclidean zoning. And so today I'll actually be talking about what we found in our nationwide study both with regards to new urbanist zoning as well as more traditional Euclidean zoning. In addition to infrastructure improvements related specifically to land use, transportation, parks, and green space, there are other types of strategies that communities can take that we often see in zoning codes related to reduced or eliminated parking requirements, which can help to preserve open space, reduce congestion, promote transportation choices, and really provide more room for new homes and dense walkable communities. That's our goal as public health practitioners, is to have more walkable communities where people live, work, and play. And obviously, you're the ones responsible for designing the communities and implementing the land use and transportation strategies. And so I think we have mutually beneficial goals here. In addition, thinking about density bonuses and how communities can be designed in a way that will support open space, streetscape improvements, bicycle infrastructure, and other strategies that we've identified in public health as being particularly effective for improving people's physical activity levels. So what did we do? We have 4 overarching questions for this study. It was really looking at whether over the past decade, activity-oriented zoning has increased over time. In particular, whether new urbanist or code reform zoning is associated with more activity-oriented zoning, given the premise behind new urbanism is really about creating pedestrian-friendly communities. We wanted to document that and show, in fact, that that's happening. We wanted to identify what characteristics of a community are associated with more activity-oriented zoning, and whether or not some of those other provisions related to the parking, eliminated parking requirements, as well as density bonuses, how prevalent they were in communities. So as I mentioned earlier, we originally did a study in 2010. That was our baseline study. That included over 4,000 jurisdictions in the most populous 496 US counties and 4 consolidated cities located in 49 states and DC that covered about 75% of the population. For our 2020 follow-on, we covered about half of that study. So we kept the most populous 200 US counties from the 2010 sample and 2,298 municipalities and unincorporated areas from the original study located in 41 states and DC, which cover about 55% of the US population. So our focus today is going to be on this panel of over nearly 2,300 jurisdictions. Just to give you a sense of what our panel looks like in terms of characteristics, there are probably about medium-sized jurisdictions on average, although they range from very small jurisdictions within the counties to the largest of the large municipalities. About 1/3 of the jurisdictions have less than 11,000 people, so we do have really good representation in terms of size of their jurisdictions, in terms of small, medium, and large. In terms of comparison to national averages relative to poverty and median age, we're pretty comparable. Same with the percentage of housing units that are occupied with no vehicle. I didn't have the national data, land area data on rurality, but we have a rural work group in Paperin, and so I wanted to show that on average about 4% of the jurisdiction lands area is for rural areas, but it ranges from 0 to 100% within our 2,300 jurisdictions. And our jurisdictions are relatively equally divided in terms of measures of racialized economic segregation, from being more disadvantaged to being relatively advantaged, and we're fairly evenly distributed across regions. We compiled zoning codes for all the jurisdictions, primarily through municipal code publishers, although in some jurisdictions we had to follow up directly with the jurisdiction. We ended up getting about 81% of our codes in 2020 from the online publishers, about 2/3 of them in 2010. And the rest of them were obtained from individual jurisdictions directly with some follow-up as needed. And if you were one of the jurisdictions we had to follow up with directly and you responded, thank you. We had a number of urban planners over the years. I have like an army of them in my 2010 study, but we had a really good, strong team of urban planners that helped to analyze all the data. And so I'm not going to go into all the details about how we did it, but I just wanted to show you, and this is a paper version of our electronic audit tool for evaluating the zoning codes. but we had a number, about 15 markers related to physical activity that we evaluated based on the type of zoning that they had. So for code reform zoning or code reform jurisdictions, such as PODs or TODs, we coded them separately from traditional Euclidean types of districts and zones. And we coded for every single district or zone where we found a marker related to sidewalks, crosswalks, bike path connectivity, street connectivity, bike lanes, bike parking, etc. So what did we find? Code reform zoning, as you would imagine, has increased significantly over time. So in our 2,298 jurisdictions that we followed from 2010 to 2020, we saw a significant increase, by 8 percentage points, or 9 percentage points in code reform zoning. And in TOD zoning and form-based codes, it was somewhat lower, but it was still an increase. Now, I just want to remind you, this is just for our nearly 2,300 jurisdictions. This is not for all jurisdictions in the US, but this is for our 23 jurisdictions. This is what the distribution of code reform looks like, as well as TOD zoning and form-based codes in general. In our 200 counties where our 2,298 communities were located, we looked at the distribution of code reform zoning across the US. And as you can see, as we know, Smart Code, for example, started in Florida and diffused over time. And we saw those hotspots grow stronger, particularly in Florida and California over time. But there were additional hotspots that developed, particularly in the Northeast and the Mid-Atlantic and other pockets of the country that we had not seen in 2010. And again, this is just a map of the 2,298 jurisdictions in the most populous 200 counties that we studied for this project. As I mentioned, our second question wanted to look at whether or not activity-supported built environment features addressed in zoning codes also increased over time, regardless of whether it was in a code reform zoning or not. And as you can see across the board, we saw an increase in all physical activity-related markers. And it was a significant increase across the board, which was quite encouraging, because in our initial study, only about 1 in 10, or a little more than 1 in 10 jurisdictions we studied had provisions for bike lanes in their zoning code, and that's now over a quarter of them. And we saw concomitant increases across the board with all the different measures that we have evidence for are associated with physical activity. When we looked at whether or not those provisions are more prevalent in code reform, which is of course what you would expect, given code reform zoning is designed to create more pedestrian-friendly communities, we did see that across the board. And so we saw in many cases that code reform zoning was associated with almost more than double the provisions than in jurisdictions that were not in code reform communities. When we looked at those additional physical activity supported infrastructure improvements, we also saw that code reform zoning was associated with more of these provisions. So providing provisions for public transit access, more than double in code reform versus non-code reform jurisdictions. Provisions for pedestrian plazas in the zoning code, again, almost double. And those reduced or eliminated parking requirements, again, almost double in code reform versus non-code reform jurisdictions. We also looked at the extent to which zoning provisions provide opportunities for density bonuses for developers to develop open and green space, pedestrian amenities, streetscape improvements, and other bicycle amenities. And again, across the board, we saw code reform was more likely to offer these provisions, or include these provisions, I should say, or allow for them in their zoning codes. In terms of factors associated with more activity-oriented zoning, as you would imagine, we tend to see it more commonly in larger jurisdictions, those in the South, because as you saw on those maps, that's obviously where code reform started and where we started to see most of this activity, and households that are more likely to not have a vehicle, because obviously they need to take advantage of public transit and things like that. As you might recall from the characteristics I showed you about the communities, one of the measures we looked at was a measure of racialized economic segregation, which includes a combination of income, median household income, and majority race in the community. And so if we look at the most segregated versus the least segregated, we tend to see that the most segregated jurisdictions are less likely to have in their zoning code provisions for bike ped connectivity, for bike and ped trails, for mixed use development, three things that have been shown in particular to be particularly associated with physical activity in the communities. So where can you go from here? Marsha and I were talking about sort of, what would be most beneficial for you. And I want to share with you some thoughts that we have, both as me personally, as well as a field, about what you can do in next steps that you can take in your communities. So first, there's obviously clear opportunities here for the planning community. If you're with a planning agency, partnering with public health agencies and transportation agencies, public health scholars or researchers like myself, when you're considering revising your zoning codes to make physical activity orientation a priority, rezoning or new zoning efforts, or even overlays that you're considering in the community. If you're an advocate or working with advocates, really working across sectors to advocate for more physical activity oriented or pedestrian friendly zoning provisions. And in particular, working to advocate for funding to support implementation. That's the biggest challenge, right? Getting something on the books is great, but if we don't have the resources or the champions to support implementation, it's not going to happen. So as I alluded at the beginning of the presentation, there are many benefits to physical activity. The next set of slides is from the International Society for Physical Activity and Health. They have a great series of resources on 8 investments communities can take to support physical activity that will have co-benefits. And so those co-benefits include health, economic benefits, social benefits, and environmental benefits. And so how do you make the case for that investing in physical activity oriented infrastructure matters? You can talk about benefits for children, benefits for adults, and benefits for healthy aging. So depending on the demographic characteristics of your community, there are different benefits that will be relevant. So for example, if you have a community that has lots of young children in it, if physical activity reduces the risk of depression, it improves bone health, it promotes favorable body composition, improves attention, and some measures of academic performance, particularly when in conjunction with school-based physical activity. If you have a community that's heavily aging of the population, older adults, having more physical activity supportive environments helps to improve sleep, reduce risk of falls, extend years of active life, delays onset of cognitive decline. In addition, there are a tremendous amount of economic benefits to communities. At the outset of the presentation, I talked about how physical inactivity costs over $117 billion a year in healthcare costs. That's tremendous. That's a tremendous economic impact on our communities. So there are data that show that investing in physical activity supportive communities can help to increase levels of retail and economic activity. I'm preaching to the choir with all of you in CNU, because this, that's what code reforms do. They create places where people want to live, work, and play, right? So investing in that can help to not only have co-benefits with physical activity, but obviously the economic benefits that you all espouse, along with property value increases, neighborhood revitalization, and reduced healthcare costs. In the workforce, people take fewer sick days if they're physically active, and having more walkable communities can create more safe places for people to be physically active. So I mentioned ISPA, and I'll be happy to share this link with Marsha and Rob after that they can send out to you. But this is a great resource about 8 investments, and it talks about the evidence that I just briefly described that you can use to advocate for, inform, and lead discussions in your community relative to these infrastructure investments. And at the crux of those 8 investments is that there's no one investment alone that will shift the needle on physical inactivity. It's a combination of investments. And so taking a systems-based approach of working with public health, working with transportation is going to be critical. And so 2 of the investments they identified, much like the CDC strategies that I talked about at the beginning of the presentation, relate specifically to active travel and active urban design. And so on active travel, supporting transport policies, inducing more demand for public transit use and active travel. And there are multiple co-benefits for sustainable development goals. We're all thinking about sustainability and issues related to that. And so this resource really goes into detail on the evidence for these things that might help you with your discussion in your communities. Likewise, active urban design helps to create, engaging in dialogue to create more supportive and equitable policies and amenities that create places for people and makes the community more appealing. I'm preaching to the choir with all of you. So where are we going with all this? One of Marsha's questions to me was, have we linked our data to health outcomes? So I have some preliminary data that I didn't have time to share with you today that we did just with our 2010 data. And I can tell you from that data alone, just in cross-sectional associations, we saw that having more fiscal activity-oriented zoning or even code reform zoning is associated with people being more fiscally active and less likely to be fiscally inactive. We also saw that rates of cancer in these communities is less prevalent in jurisdictions that also have more dense infrastructure and create more walkable connected networks. We also found in those prior analyses that journey of work data used in the American Community Survey data, people were more likely to report walking and biking to work in jurisdictions that had co-reform zoning, as well as more activity-oriented zoning in general. For the linked analysis now, we're actually going to look longitudinally and look at cross-sectional changes in fiscal activity behaviors and sedentary behavior, as well as pedestrian fatalities in jurisdictions that have changed over time to being more fiscal activity supported with their zoning, and whether or not we've seen changes in jurisdictions that had these zoning provisions on the books in 2010 and still have it in 2020. Hopefully there's been some implementation that we can look at to see the relationship with these health outcomes. And then we're going to be doing some qualitative work, and I may be reaching out to some of you to look at strategies that the public health sector can take to support implementation of these zoning codes in their communities, and really engaging with how public health sector can work with planning, zoning, and transportation agencies to really support not just the adoption of these policies, but really support implementation and evaluation efforts. So if you're interested in learning more about the Fiscal Activity Policy Research and Evaluation Network, we're a network open to all. We have about 800 members, multi-sectoral. We have planners, we have transportation engineers, we have government agency people, we have public health practitioners, you name it, they're part of it. It's free to join. All of our webinars and green rounds are free. Resources are all free. We would love to have you engage with us. So with that, I'm going to stop sharing my screen. And I think Marsha and I are going to engage in some dialogue.
Thank you, Jamie. That's such a great presentation. Thank you for sharing the results of your research. I think it's particularly powerful to have what I would consider kind of a non-traditional partner in planning with public health. It's not something that, we do talk about cross-disciplinary work with smart planning, making sure that different kinds of perspectives are taken into consideration. So talk a little bit more about how we can involve our public health, our local public health representatives in the planning. What do we approach them? Do we check with the jurisdiction about what relationship already exists to pull them into that conversation, or do we just pull them in cold?
Thanks very much for the question. And it's probably one of the most important questions I think you would ask me today. So I'm really glad you did ask it. First of all, if you are at all involved or engaged with an urban planning school, and your school is part of a university that has a public health school as well, the first place to start would be to establish joint degree programs. We have one here. We have a great urban planning program at UIC, University of Illinois, Chicago, as many of you may know. We also have a great public health school that I help to lead. And so having joint degree programs is a great first place to start, so that people are getting trained in both public health and urban planning and start to cross-fertilize, right? So that's a first place to start. In terms of your bigger question, though, about for the practitioners on the call, there are a couple of places to start. One is, yes, ask the right questions about, are you already engaging with people in the public health department in our community? If yes, how so? What are you talking about? Is it just about complete streets? How can we leverage the complete streets discussion into a broader discussion about zoning, right? Most communities reevaluate their zoning code, once every decade, 2 decades, whatever. There's also the opportunity to engage them in all the planning efforts, the master and comprehensive planning efforts that go on across the country. And so engaging public health in those planning discussions be a great way to pull them in to start to dialogue about, the co-benefits of planning and zoning and land use and transportation with public health and vice versa. The public health people, we do research on this on a daily basis. So we know the evidence about how all of the incredible work that you all on this call are doing helps to make people more fiscally active, helps to reduce healthcare costs, help to improve economic development. We have that data, we have that evidence, and so we can help you in making the case for why this work is needed or on the implementation side. The next part is on the cold calling. I guarantee you, if a planner reaches out to me as a public health practitioner and said, hey, we want to work on, I'm not going to use Chicago because Chicago is a unique beast, right? And that our planners are talking with public health here to some extent, but let's use a small community in the middle of the country that maybe hasn't been engaged in any of this. The public health department is always looking for allies. We don't have the same resources as planning and transportation have. We don't get federal highway funds to support transportation projects that can be used to build new streets and new infrastructure for sidewalks. But we can sure tell you, we can do health equity assessments and health impact assessments to really tell you where are the areas of need in the community, where do we see the least amount of fiscal activity, where do we see the highest healthcare costs, where do we see the highest rates of falls or crashes or whatever, that maybe could help you with prioritizing your projects for implementation. So there are a lot of places you can start, and cold calling is not a bad thing, as long as you sort of explain it, that I actually want to talk with you about how can we help each other, right? How can we help each other engage in that dialogue? And the last place I'll mention is the American Planning Association has a whole center for community health planning. My friend Sagar Shah heads that up. He's actually on our external advisory board for the Fiscal Activity Policy Research and Evaluation Network. And he, like I, am very engaged with the Centers for Disease Control and Prevention on developing resources. He develops resources for public health community about how they can engage in this process. And he'd be a great partner for you to reach out to and say, hey, I want to engage with public health. Can you help me make those connections? And I'm happy to do the same.
That's great information. Thank you for that, Jamie. You mentioned a little bit about the health impact assessment. I don't know that very many of us are familiar with what that is. It's something just like the environmental impact assessment, the EIAs. So talk a little bit more about HIAs and how we can use that in planning.
Yeah, so HIAs are very similar to EIAs, right? So HIAs are really looking at sort of the co-benefits, health-related co-benefits of a policy decision or a planning effort. It's no different than what you would do with an EIA, looking at the environmental impacts. And so, I've been part of several HIAs over the years on different policy issues. I'm a policy researcher by training, and I sort of fell into this whole urban planning research space a number of years ago, and it's probably my by far my favorite area of research that I do. I find the most value in it. And so HIAs, I actually have one of my doctoral students teaching an HIA course for our urban planning students, specifically so they can start to think about, what are the health impacts of adding a new transportation line or a TOD or creating a pedestrian-oriented development. What are the health impacts of that? Not only that, but what are going to be the concomitant economic impacts and benefits for the community? And so, public health researchers can help you with pulling in the data that you need or helping you design this HIA, and it can be a partner in working together on these things. And they may be able to leverage resources to help conduct the HIA to complement your own efforts that you're doing with your planning and other efforts.
Right, I think, having access to resources that planners don't normally have access to and really are only accessed by public health officials and the CDC. Are there has there been any work with public health officials working with some of the grants that are available with the Department of Transportation? We do have our DOT secretary, Buttigieg, who's actively advocating for the Safe Streets and Roads for All program. Now, the application period had ended, I think, in September, so it's not something that we can promote that you take advantage of or anyone take advantage of now, but something to keep an eye on, and something I think that kind of
The perfect example.
it hits, yeah, I think it just really points to the fact that it is being more seriously considered, that safety and health is very much interconnected with planning, and whether or not there are, you can put all of the kind of, gyms and parks available, but if you can't reach them easily and you're just going there from your car, then it's not really that helpful. So to be able to have programs available or incentives that developers or planners can have access to leverage that planning. That's
absolutely. So one of my early slides was on Active People, Healthy Nation, and CDC has a partner group for Active People, Healthy Nation that includes not just myself, but also representatives from America Walks, from the League of American Bicyclists, from plenty organizations, from transportation agencies, YMCAs, you name it.
to school.
And so there's about 20 something of us on this group. And we are always discussing these issues and how to leverage each other. We actually hosted in Paprin a federal panel about a year ago, specifically to talk about this cross-sectoral dialogue and how transportation researchers and advocates could engage in studying these issues and helping to fund these projects. And so you're spot on, Marsha. We are continuing to have these dialogues with DOT, with HUD, Housing and Urban Development. And actually, I did a webinar for FHWA a couple months back on complete streets and sort of public health and complete streets, public health engagement and complete streets policy making. And there were probably about, I don't know, over 500 people on that webinar, all there for the same reason as all of you were on today about, how can we really work together to leverage our limited resources that we all have. And, each of us brings different things to the table. So to the extent that you have these funding opportunities and you, might want to bring in public health researchers at universities or public health agencies in your community in on those grants so that you can work together on implementation and developing new projects, that would probably be the ideal scenario. And we want to do the same. We don't get the money to build infrastructure. You get the money to build infrastructure. We get the money to make the case for how that infrastructure works or why it works. We get the money to help you show the positive benefits that it's having on health outcomes. One of the things I often find when I do my talks around the country on these issues is, I did a series actually of key informant interviews with jurisdictions that implemented co-reform zoning. This was a couple of years ago, and I'm happy to share that report with you. It was really about lessons learned and in implementing. And one of the things that I always asked them was, so do you measure sort of the extent to which, pedestrian usage has increased? And they're like, we don't even know where to start with doing that. How do we even do that? And I'm like, we can help you, right? That's what we do in public health. And so I think it could be a marriage made in heaven.
I agree. And it's just such a logical joint partnership. If you have access to these kinds of funds and we've got access to these kinds of funds, then
and data, we use data all the time, big data, to study these issues. And so it's sort of a natural starting point for us.
Right. And if you could also elaborate on the types of jurisdictions that were part of your study. Is there a list of them? Do you have access to them? And then, you also mentioned as a follow-up to your research that you're going to then take a look at those jurisdictions and try to measure actual health outcomes. What's the timeline on that? I think we're all kind of like waiting with bated
Well,
breath.
I have all my preliminary studies that I did that have been published, and I have 6 papers that I can send to you all to share with this group. And those were the ones linking to sedentary behavior, activity, active route, safe, active travel to work. We had a TOD one in particular where we looked at jurisdictions that hit TODs. We saw an increased use of active travel to work, walking and biking to work, and public transit use. And we had the cancer paper. So those are all published. I can share those. The qualitative implementation study that I did, I can share that resource with you as well. The longitudinal study that I'm working on now. So bear with me because my time point for my second round of zoning data was 2020. What happened in 2020? The pandemic. So my outcome data is all delayed because I haven't gotten access to it. And we're going to sort of see what that data even looks like, because depending on the jurisdiction they lived in, people may or may not have been even allowed to be outside being physically active, right? So, so you're just gonna have to bear with me. Like the journey of work data for 2021, I'm not sure how much we're going to be able to make of it, at least for the first half of the year, with what was going on with people still working from home. So we may need to wait a couple of years for the true linked data, for the multi-year linked, but the preliminary linked data, I can send all that right away. I don't have a public listing of all my jurisdictions, but I am going to be making all the data publicly available eventually. We're just not there yet. But if there are any researchers on the call that are interested in collaborating with me on linked analyses, I'd be more than happy to do that through restricted use agreements and collaborating with you on that. In terms of the nature of the communities, so it's pretty much every jurisdiction, every municipality, township, village, incorporated jurisdiction in the most populous 200 US counties and all unincorporated county areas. So the only ones we did not include in those 200 counties were the smallest of the small jurisdictions that accounted for less than 0.5% of the jurisdiction of the county population. So we just had to stop somewhere because of resources, and that was our only cutoff. So we lost very few jurisdictions. So those 2,300 approximate jurisdictions that I have are nearly all the jurisdictions in those most populous 200 US counties.
Okay, great. I think we're all looking forward to the next step in your research. And we do have a few questions I want to bring to your attention. And I knew that the health impact assessment buzzword would kind of get ears piqued. So do you know of any programs or of any projects, I should say, that have used an HIA as part of their planning process?
Yeah, so let me get back to you on that, Marsha, if that's okay. As I mentioned, my doctoral student teaches a course specifically on HIAs for our planning students, and it's specifically focused on that exact question. And so she probably has some good examples that I don't have readily available at the moment, but I'd be more than happy to send you some links along with the other resources I'm going to send that you can share with this group. And in fact, she actually usually has them work on a project with a community who's interested in having an HIA done. So if you're a community and you want for a urban planning, public health joint class to maybe work on a semester-long HIA for you, let me know. She can put you in the queue, and maybe she probably already, she just completed, I think, this semester, but I know she's doing it for spring. She probably has them identified, but maybe for next spring, she might be able to take you up on it and give you a free HIA for your community.
I think they'd be very interested in that. And if there's any information about, you know, how to use an HIA, I think that's what's one of the questions from.
So Rob, I just want to tell you, I'm going to send you all the links to include that one. There isn't quite the links that I was showing. So if you want to just hold off, I'll send all the links after today's session if you want to send them out. That way you'll have everything in one package.
Very helpful. We have another question from Terry Schweitzer, who says that our MPO is embarking on the development of a new metropolitan transportation plan, and they have recruited a representative from the local health department to take part.
Great question.
What would be the advice you would pass along to this individual to promote the public health perspective?
Terry, I'm going to send one more resource for you. Or if you want to, Rob, put my email in the chat. People feel free to email me afterwards and I can send them as well. I also did a primer for public health practitioners about working with planning and zoning officials and to help them understand the planning and zoning language and opportunities for engagement and where do you have common dialogue. And so that sort of 101 for public health would probably be a great place to refer them to. APA has done some as well, but I've heard really great feedback on the one we put together. We did this for CDC to share with their state recipients working on physical activity issues who are working on actively flying routes to everyday destinations. I also have a great consultant for you who you might want to engage with, who serves as a technical assistance provider for CDC for all their recipients working on activity friendly routes to everyday destinations. His name is Mark Fenton. He is an urban planner and he's a public health urban planner. And so he engages really well with both sectors and really helps make those connections. And so he'd be another great resource for you. And I saw Marsha shaking her head, so you probably know Mark. I know you're in the Northeast, so you probably definitely know Mark.
Yeah, Mark is from the New England area originally, and he did this really great PBS program. I think it's America Walks. Maybe I might be getting that wrong, but he's really wonderful. I think he's trained in engineering by trade, or maybe like aerodynamic engineering, nothing related really to health, but his campaign for several years now has been that walking is so important and it can't be done without the proper infrastructure in place. And we all have access to treadmills, but it's just really not the same as the kind of emotional and physical well-being that comes with getting outside and walking. So I don't see any other questions there. I've had some really great ones already answered, but is there anything else, Jamie, you want to share with everyone as kind of parting?
No, I really appreciate this opportunity. I'm excited. I'm always excited to talk with other people from other sectors. And in this particular case, I feel like, as I said, I feel like we're a marriage made in heaven. I would welcome the opportunity to collaborate with anyone on this call. Feel free to reach out. Rob put my email address in the chat there. And right after we hang up, I will send all those resources that I promised, so I don't forget about them. And feel free to share them, post them, whatever you want to do with them.
Thank you, Jamie, and thank you, Marsha. I really appreciate you coming on. And the video will be posted on cnu.org in probably within 24 hours. And there also will be a piece on Public Square that will have the video embedded in it. And this has been a really interesting discussion.
Super. Thanks, everyone.
Thanks, Rob. Thank you, Jamie.
Have a good day.